All right, perfect. Well, hello everyone, and welcome to the August meeting for the Rural HPV Vaccination Learning Community. On behalf of the American Cancer Society, the National HPV Vaccination Roundtable, I do want to thank you all for taking time out of your busy schedules to join us live today or in via recording in the future. So today will be our first session that we can offer both live and enduring CME and CNE credits. And today's meeting, we're really going to be focused around our summer quality improvement series and focusing on evidence-based interventions and HPV vaccinations. So as always, I'm Ashley Locke. I'm an HPV program manager for geographic disparities at the American Cancer Society, and have the honor of talking with you guys first. But I am a part of a larger team that encompasses many colleagues from both the American Cancer Society and the National HPV Vaccination Roundtable who work on increasing HPV vaccines. So I do want to go through a quick roadmap for today's call. So just in a couple minutes, you'll hear from Dr. Stephanie Staras shortly, followed by a panel talking about their experience with evidence-based interventions in HPV vaccines. And then we are going to wrap up this call with a few resources to share. I do want to share a couple of quick reminders. So all of our rural HPV vaccination learning community sessions are recorded and posted to a public-facing website. This session is certified for CME and CNE credits, and we've added a document or a link to a document that details out information for live CME and CNE credits. You can also find them on our website. And just for CME and CNE purposes, all speakers, panelists, and planners involved in this session have nothing to disclose. We ask all participants to stay muted until our panel discussion, and the Zoom chat will be open for questions and support. Next slide. So as always, both the American Cancer Society and the National HPV Vaccination Roundtable take a systematic approach to our quality improvement framework. This slide in particular showcases the steps that we use with our partners to not only improve HPV vaccination rates, but also cancer screenings. And today we will be exploring evidence-based interventions more in depth. Before we do so, we have a quick poll that we want to have each of you guys take. We just want to see where everyone is at when it comes to evidence-based interventions. So feel free, give you a couple of minutes to do so. And just some of the questions that we're asking, do you have any experience in implementing evidence-based interventions to increase HPV vaccines? What interventions have you implemented when it comes to HPV vaccines? And you can select all that you want to, and then, share what was successful. So looks like we're slowly getting some participation. Appreciate that. Give it a little bit more time. We're about 40% participation. Would love to see a little bit higher. And for those that are just joining, we're asking for you to take a poll, just kind of share your experience around evidence-based interventions and HPV vaccines. Looks like we're at about 50%, hoping to get a little bit higher. All right, we can go ahead and end that poll. Perfect. All right, we can go to the next slide. So I'm going to go ahead and introduce Dr. Staras to the group. Dr. Staras is an expert in rigorous and impactful research and prevention of human papillomavirus related cancers and using implementation science methods to increase health equity. She focuses on improving the clinical recommendations for parent receptiveness to and access to HPV vaccine among adolescents within Florida. She has received as a principal investigator on a series of investigator-initiated National Institutes of Health, National Cancer Institute funded grants, so R21, R37s, and R01s, with a total federal funding of $8.5 million. These large, high enrolling projects contributed critically to the UF Cancer Center's NCI designation by demonstrating the necessary impact and comprising 40% of UF's clinical trial accruals in the past 3 years. Welcome, Dr. Staras, and go ahead and take it away.
Thank you. I'm delighted to be here to be presenting on evidence-based interventions in HPV vaccinations. We'll be giving you just a slight overview this afternoon. So the learning objectives we have for you today are first, to describe how to increase on-time HPV vaccination rates in rural communities. We'll give you a lot of strategies. I'll cover a list of evidence-based interventions to increase HPV vaccinations, and we'll give you tools that you can use in your community. And then for our panel, we're going to compare best practices and challenges in increasing HPV vaccinations in rural settings. So first, I want to talk about what evidence-based interventions are. So I know we asked you that in the poll. But evidence-based interventions are approaches to prevention or treatment that are peer-reviewed and have documented empirical evidence of effectiveness by research or evaluation. So what that really means is somebody has done a study where they measured whether this intervention actually increases the targeted outcome. Now, slightly lower is evidence-informed interventions. So they haven't been fully evaluated, but they use the best available research and practice knowledge to guide the program design and implementation. The advantages of using evidence-based or evidence-informed interventions are that they increase the likelihood of your initiative being successful, because this is something that has been used successfully in the past. You can also increase the cost benefit because you can save time and resources by using resources that others have created. So this can save you time during both planning and implementation. It also adds value and evidence when you present your proposed program to your stakeholder. So you can say, you know, we're using these evidence-based interventions and we want to do them here at our clinic. Also, they help you define what to evaluate and where you are looking for impact. So sometimes these outcomes are difficult to figure out, but usually if you're using an evidence-based intervention, they might spell out for you how they did it. So I believe that this has been highlighted in previous webinars with this group, but we know that interventions are best done when in combination. So this slide really shows kind of 3 groups that are focused for HPV vaccination. So we have patient or parent-directed interventions, with provider-directed interventions, and interventions that increase community access. And you can see they're all kind of working together. So some of the recommended evidence-based interventions for HPV vaccination are shown here. And I'm going to be able to go into most of these in some more detail as we go through. But when you were looking back at the slides, this kind of shows a list of several of them. So we also wonder, you know, where should you go to look when you're thinking about what type of evidence-based intervention to do? Well, one of the great resources that's on this slide, and I see has just been put in the chat, is the community guide. And the community guide is done by the Community Preventive Services Task Force. And what they do is they take the literature and review for all the scientific evidence of what interventions work and what interventions don't have as much evidence. So then they categorize them into these three categories. So you can see recommended interventions are shown in a green with a green circle. So we would call those the evidence-based interventions because we know they've been shown to be effective. We also have interventions where it's not quite clear. Maybe some of the intervention, sometimes this intervention has used, we've seen positive effects, sometimes maybe no effects. And so they give this one a diamond, a yellow diamond. And then finally, some strategies are deemed as really not recommended or not best practices. And these are shown with a red triangle. Fortunately, we don't really have any of those for HPV vaccination right now. But you can see here that there are a variety of recommended interventions across these three categories of looking at parents, providers, and the community. So first, I'll start by letting you know about patient-directed interventions. So when we think about the patients, one of the classic examples for patients is vaccine reminders or recall. And it's considered recall when you've already kind of missed a dose, and a reminder maybe when it's before you're overdue. So client reminders can be written or telephone messages or really any variety of tech. So you can do postcards or letters, text messages, phone calls from your staff, and messages through your patient portal to let people know what that their child is due for the HPV vaccine. And you can even include educational information in these reminders so they know, this one says help your child stay healthy and get the HPV vaccine. So there are several sources that you can use that are already created, and you can integrate them into your own systems. Now, another option is small media. So small media is considered any videos or printed materials that you might want to use in your clinic. And this will be used to motivate people to get the HPV vaccine. So you can see there's a whole bunch of different suggestions right here on this slide. And I think they'll be putting some of these in the chat. But if you choose to use one of these, one thing we want you to think about is you can, use this as the basic information and then target it to your general audience. So when you read these flyers, think about, is this really the health literacy of my target population? Or should I rewrite some of the words so that it's a little simpler language? You also want to think about selecting images that reflect your target population. So if you look at this flyer with the images of children and they don't look like your patients, that's fine. You can replace these with pictures that do. And then before you decide to use any small media, you need to think about how this will fit into your workflow and who's going to be really in charge. And when they're using it, how is it going to compete or help what they're already doing? So then probably the most research on HPV vaccination is under provider-directed interventions. And we can let you know that providers are one of the most influential pieces of who will get the HPV vaccination. There's a systematic review that shows that a strong provider recommendation can increase HPV vaccine initiation by 10-fold. So it's really important that you get your providers to be strongly recommending the vaccine. One of the strategies is shown here. And this is probably one of the simplest and actually very effective, which is provider assessment and feedback. So it really just involves going through your charts, whether they're electronic or you can use your state registry and look at your vaccination rates. So this table shows a run table for 3 different groups. They do family medicine, internal medicine, and pediatrics, but you could do this for each of your individual providers if you wanted. Now, it's suggested that maybe you start with de-identified data and you could present a chart like this to your whole clinic. But then you can also start thinking about other things to do, which include like doing a comparison. So sometimes it's called benchmarking. So maybe I would pull one provider and get their rate, say it's 30% of their teens have received the first dose of HPV vaccine. But the person that's doing the best in my clinic is at 50%. So I would give them that individual data where I would show them, here's you, and here's the best person in our clinic. And I might not show them who that person is. Now, I do know that some clinics have actually been successful with just totally giving identifiable data, and people are very happy with that strategy. But you need to make sure whatever strategy you choose, all of your stakeholders are on board and people can know about, okay, if my rate is here, how do I increase it? So the provider recommendation has been studied pretty extensively, and what's recommended is an announcement approach. This approach is suggesting that you announce the vaccine by saying, Marcus is now 9, so today he'll get a vaccine that prevents 6 cancers. And then wait and see what the parent says. If the parent's hesitant, really focusing on their main concern and address it. And then don't worry if the parent isn't ready that day. We know that 70% of parents who initially decline the HPV vaccine will eventually say yes. So don't count them out. Make sure you bring it up again when they come back. And use a presumptive announcement that really suggests that you think they will be getting this vaccine. We also, the other side of this shows some research tested messages to address HPV vaccine concerns. So you can even share this with your providers of here's some of the common questions and here's some answers for concerns. And this is on HPV IQ. So as I said, the provider recommendation has a lot of information you can find. So the CDC also has some information, as well as cancer.org. On the left of this slide is some videos that show different providers talking about how they recommend the HPV vaccine. So you can see really how they take that kind of common approach of an announcement approach, and saying, we're due for the HPV vaccine today, and how they do it with their own style. There's also this talking to parents about HPV vaccine, goes through questions parents might have and answers that you can provide. And then the HPV vaccines FAQs kind of goes through, here's some facts that people may not know about the vaccine, such as the vaccine is safe, and really how we know that, and some talking points. So these are really to help your providers have better conversations. So we also know that in addition to your providers who are recommending the vaccine, your patients are dealing with other staff at your clinic. And we really want to make sure that all of the staff are on the same page. So if your clinic is starting vaccination at age 9, that everybody's on board with that, and you don't have one person who's telling people when asked, oh no, I would never vaccinate my child at that age. So you can do trainings for your whole staff, and these can focus on, they can be set the foundation for your evidence-based implementation. When you figure out maybe what is kind of something people don't understand, then you can work on that piece. And there's a lot of resources on this page as well that talk about starting vaccination at age 9. So there's a series of articles in Human Vaccines and Immunotherapeutics. And there's also a series of videos that are on YouTube. So you can see all the evidence about age 9. So if you're concerned or your staff are concerned about starting at age 9, there's a lot of resources to help you. So just like parents, providers also do well with a reminder. So we can do this in a variety of ways with which range in tech support, right? So you can do low tech, and there's been plenty of beautiful interventions with very low tech solutions. So they do maybe physical reminders and charts. You can put a sticky note to remind the providers that this child needs the HPV vaccination. And these are particularly important when you're focusing outside of the well visits. So we know that vaccines are really thought about a lot during well visits, but our other visits are a perfect opportunity to get those children vaccinated. You can also have prompts through your EHR system that can notify your providers, and the state immunization registries can help you identify who is in need of the HPV vaccine. There's been some evidence that a daily huddle is a great way. So if you review all your scheduled patients and see who's due for vaccines that day, this can help remind people to be aware and thinking about the HPV vaccine. And then also even laminated cue cards can help people remember. So another strategy is standing orders. And standing orders is when the nurses, medical assistants, pharmacists, and others are provided access to the patient's immunization status, as well as the ability to administer the vaccinations without a physician order for that individual patient. So this is an order that says all people under these conditions should receive the vaccine, and you don't need a physician to sign off on each individual one. Now, the ability of these support staff to administer vaccines will differ by state, so make sure you check that with your state. But if you're interested in standing orders, it's a great way to increase your HPV vaccination rates and is very effective. And the Immunization Action Coalition has a 10-step guide for how you could do this at your practice. And we want to make sure we don't forget that we need them to complete the series, right? So a lot of times these interventions focus on getting that first dose, but we want to make sure that people are completing the series. So for those under 15, that will be receiving 2 doses, and those who start after 15, that will be completing the 3 doses. So one of the best strategies to do this is actually scheduling the patient's follow-up appointment for the second dose before they leave the clinic. So they get their first dose and you tell them, great, you need to come back in 6 to 12 months. Let's get you scheduled. Now, some of the stumbling blocks for clinics to get this set up are that sometimes they don't have their schedules out for their providers that long, and then they wind up not scheduling it and this doesn't get done. So that is a challenge that you need to conquer before you try to use this strategy. We just talked about standing orders, but it is helpful because these families have usually decided they're already in on the vaccine, and so they don't need to really ask questions. They're just ready to get it. There is evidence about having open clinic hours. So can I have hours where people can just come in and get vaccines? Or can we partner with urgent care or a pharmacy to say, okay, we've already talked to these patients. They've already got their first dose. Can they get their second dose in somewhere that might be more convenient to their house? And then while we talked about reminders at the beginning, we talked more about using different modes based on maybe your preference. But there are a couple of strategies that look at the patient's preference. So if you have already collected, sometimes they already collect, how would you like to receive your vaccine, your appointment reminders? So you can just use that information you already have and go ahead and use that to send them a reminder that, okay, it's been 6 months, it's time to get your second dose. And then emphasizing again that using this opportunity to vaccinate, not just in well visits, but the sport physicals or sick visits, make sure that if they're there and they're due for the vaccine, you give them that opportunity. So, and then finally, we'll talk about access to care interventions. So these interventions may be particularly important in rural areas where access is often more of a challenge because of the greater distance between the patients and their providers. So some things that can be done, one that directly addresses the distance is patient transportation through vouchers or assistance. And this has actually been successful in increasing vaccination. So this would be something you'd want to try if you know that people are really having trouble actually just making it to the appointment. If you have more of a challenge of your population just isn't able to afford the administrative fee, I know some clinics have been successful in being able to waive that administrative fee for the patients that cannot. You can also, as we talked about a little bit previously, add and promote shot-only appointments. So you can say, you don't need to have a whole well visit just to come in and get this shot. There is evidence that having evening or weekend hours actually makes it much more feasible for families to get the HPV vaccine. So they will come in during those times, and then that can increase your HPV vaccination rates. You can either partner with a school-based clinic in your area, or if you're doing a back-to-school event, bring the vaccines with you so you can use that opportunity to vaccinate more children. There's several other strategies here, such as open scheduling, let people schedule through the patient portal if that's a tech possibility for you, and emphasizing again every opportunity to vaccinate, and then promoting walk-in opportunities. So you can even say, we'll just take you anytime you want. We'll have a nurse give you the vaccine. And this works best, I think, with the standing orders. So finally, now that I've given you this whirlwind tour of some of the evidence-based interventions, we want to talk about how do we select the interventions. So we'll want you to think about several opportunities of maybe, here's 3 or 4 that kind of sound like they might fit well for my clinic. And then think about which ones you want to choose. So what is the current state? What are we trying to improve? Are we starting something new? Do we need to stop something that's not working? And a good place here to start would be to look at your vaccination rates at your clinic. Then you can look at how do these specific evidence-based interventions align with our other program goals? Are we sending out campaigns for other things? Like, did we do a COVID vaccine campaign and we can already just build off of that? Are they appropriate for our target audience? Do we think that families will think this is okay if we send them a reminder? And then do we have the resources to carry these out? Then once you've established that it's feasible, make sure you get in your leadership and team support. No intervention is successful without the leadership support. And you can talk through which strategies might be helpful. And then finally, as we mentioned slightly before, consider if you need to test this intervention and pilot it in your setting, or you need to do any customizing, like we mentioned the language or the images that might need to be changed for it to fit in your setting. So in summary, what we discussed about evidence-based interventions are that interventions are best done in combination because they work upon each other. So if you get a reminder to bring people into the office, you want to make sure that when they get there, the providers and the staff endorse and recommend the HPV vaccine. You want to choose interventions based on the problem you can solve. And then choose the process changes in addition to the interventions. So if you want to look at changing HPV vaccination, you'll want to make sure that you have the process that you're going to want to change in addition to that HPV. And as we've talked about many, many resources here, don't reinvent the wheel. Lots of people have been working really hard on this. You don't need to start from scratch. You can go ahead and start with a lot of different evidence-based interventions and start from there. And then get consensus before you decide that it's the right fit. and then move forward with your team together. So thank you.
Awesome. Let's go ahead and give it up for Dr. Staras virtually. We appreciate your conversation and your presentation on EBIs. And now we will go ahead and move to our panel discussion and welcome Tiffany Fountain, who is the Associate Director for Cancer Center Partnerships with the American Cancer Society, Dr. David Higgins, who is a physician with Child Health Clinic, as well as being a research fellow and principal investigator with CORDS at the University of Colorado. And then lastly, we're inviting Dr. Stephanie Staras back. She currently is a professor and associate chair of faculty development of health outcomes and biomedical informatics. She also serves as the associate director for the Institute of Child Health Policy, and she's the co-lead for the Cancer Control and Population Science Program at UAF Cancer Center at the University of Florida. So we have a really good panel, really great expertise in EBIs, and I'm going to go ahead and kick it off by shifting our questions just a little bit, because I think that we had really great discussion with you, Dr. Staras, to one of our additional panelists around their experiences with evidence-based interventions and HPV vaccination. So I'm going to ask Tiffany if she is online. Is Tiffany still with us? Yes.
I am still here, hanging in there.
I know you had some internet issues, so we're going to pray that you stay on for the full duration.
In the path of, currently in the path of Debbie, so hoping that I can last, fingers crossed.
Yeah, so hopefully Debbie's not a downer today.
Yes, good one.
Can you share your experiences with evidence-based interventions and HPV vaccination?
Sure, I'd love to. And thank you guys for having me. As an American Cancer Society Associate Director of Cancer Center Partnerships, as mentioned earlier, my role is really to support our health systems around goals and initiatives, especially as it aligns with ACS. So obviously, HPV vaccinations, that's one of those top priorities. And as such, looking at those opportunities to partner with these systems to increase, HPV vaccination rates in their communities, how we can connect them to resources around education and prevention. And really one of the most unique opportunities I recently had was in collaboration on an HPV project. I was working with a rural community cancer center and also a federally qualified health center separately. And the cancer center, they were working on a prevention and screening program for head and neck cancers. And in doing so, they obviously knew one of the causes is HPV. So they wanted to kind of create a larger educational and prevention campaign. So working with the FQHC, it just so happened they wanted to do a QI project on HPV vaccination. So I was like, let's see if we could really broaden the scope of this project and have a multi-pronged approach in the community. So kind of reached out to my key contacts at both of those systems, immediately got on board, and kind of going back to what was shared, you have to have those champions within those systems. So they immediately championed this work. They got me in front of leadership. Leadership buy-in, like was shared, it's so important and invaluable to the work, because if you don't have the leadership, you're kind of fighting an uphill battle, if you will. It's a little more challenging. Not saying it can't be done, a little more challenging. But leadership at both places, they knew the importance of the work. As I mentioned, rural community. So we needed to look at all the opportunities to kind of have the biggest impact, came together. And so obviously we were able to touch a larger population over a longer period of time, and really it impacted a greater number of people. So it's been a fantastic opportunity. This work is still continuing now. So I think that's a key thing when you're looking at evidence-based interventions, is really looking at the sustainability piece of that. You don't want to just be kind of one and done, like a specific project. You want to look at things in the community, what aligns with the community, meet people where they are. It's going to look different depending on urban, rural, demographics, population, financial, accessible. So many things go into it. So just making sure that you have that lens whenever you start approaching systems. So
yeah, thank you for sharing that. So you talked about two specific, I guess, like subpopulations or areas in which we can reach, rural and FQHCs. And I know Dr. Staras talked about some potential access barriers that may have to be taken into consideration when thinking about EBIs. Did you experience any of those particular factors that, we had to, like with the FQHC, we need to make sure we offered after hours, or maybe with a rule, we had to take a different approach. Can you speak to any of that? Yeah.
Absolutely. On all fronts, because ironically, when we started talking about this project, it was before COVID. And then unfortunately, COVID intersected everything that we had lined up, because very similar to what was shared in the EBIs, we were planning on doing a back to school event. And we already had the nurses lined up and everything. They were going to come on site to kind of create, the opportunity to do on site vaccinations with the students that were there, and all that just went out the window when COVID hit. So we had to kind of reimagine things. Also, I guess I should have shared too, kind of going back to looking at your community and your population. This was a very large, it is a large uninsured Hispanic population. So I saw some chat talking about Spanish materials. That was something we had to do. We had to do a lot of bilingual information translation services and things such as that. So I did want to kind of throw that in there too, to establish the foundation of the work we were doing. But something I'm super proud of, kind of talking about those barriers and the population. And we really were targeting that back to school event. That was our big, hoorah, we're going to do this. We sent out the client reminder cards. We did the provider education. It was going to culminate in this. So we kind of said, what other unique opportunities are out there? And that's when you have to put on that out of box hat, think outside, what can we do? So we said, you know what? Halloween's coming up. Why don't we get together with some of our community partners and host a drive-through Halloween event? So, so we did. And a lot of social media campaigns went into advertising it. Look into your circle of influence too, because one of the nurses knew somebody who was owned like one of those billboard companies, and they were able to get a billboard up for us advertising the event. They created a cute little theme around it. It was called Be a Lifesaver, Vaccinate Your Child for Cancer, filled little bags with information, lifesaver packages, and the nurses, social workers, anybody we could get lined up. The parents pulled through, they handed them a little bag. It was one-on-one education at the same time, because they had the parent there in front of them in the car. All safety measures were handled. Just want to make sure I share that. So I think it's, and going back to what was shared as well, all the fantastic information, everything in combination. There's not one EBI, evidence-based intervention, that's going to outshine any of the other ones. It's really making sure that you do in combination with one another to have the most impactful intervention done. So
awesome. Thank you for sharing that. So I'll shift a little bit to Dr. Higgins. If you would like to share your experiences around EBIs and HPV vaccination, we would appreciate it.
Yeah, I'd love to. So I've had multiple different experiences, but one that I'd really like to highlight today is one that I just did this past year. And this was from the funding for this was from an American Academy of Pediatrics grant to improve HPV vaccination in rural Colorado. And I helped and partnered with 3 rural clinics, including an FQHC, and the other clinics were part of a community health system, and walked them through a multi-component intervention that included, one, I partnered with the clinic staff to deliver vaccine communication training that was adapted for the whole care team. Often trainings are given only to the clinicians. I delivered it to the whole care team in their own context, in their rural settings. And then the second deliverable was that we co-designed together small media in English and Spanish. This included a variety of different things. They wanted, this was driven by what they thought was most useful. They wanted fact sheets, they wanted some posters, they wanted magnets, they wanted, radio was a really important thing for them. So we kind of created a radio spot, Frisbees, tote bags. They had a really good input into what the small media looked like and what would work best for their community. And, for this project, it involved a series of, I call them advisory group workshops to kind of adapt and optimize the evidence-based interventions and the components that were a part of this. And I can't emphasize enough that community or clinic engagement through the process of identifying, selecting, adapting, and implementing evidence-based interventions, right? Before my current role, I worked in a rural community as a pediatrician. And I was often frustrated when I saw somebody from academics or kind of from a completely different location come in as if they had all the answers and knew how things would work in my community. And so I now am that person coming in, and I strive really hard in my research and my in quality improvement work to make sure that I am doing robust community or clinic engagement processes to make sure I'm not coming in and just saying, here's how you should do it in your community. I'm coming in, I'm listening to them, I'm letting them be engaged all the way from the inception of the idea, all the way through implementation and evaluation of their interventions. So that's the that's the project that I did this year that I want to highlight. And it was a really, for me too, it was a really fun project just to get to know these communities and clinics better.
That sounds like it. It sounds like the things that I hear between you and Tiffany is letting the community lead, being willing to pivot, whether it's COVID or, you know, just like a pivot of what we need and we want to be a little bit more innovative or do things a little bit differently. And then fun, right? So like allowing them to have some of that innovation and kind of curating and designing parts of what the EBI will look like. And that not every EBI is applicable and you can use different pieces to kind of suit your population. So I think that's really, really great, the work that you guys have been doing. So I'll shift back to Stephanie. My follow-up question, I know you talked a lot about the different EBIs that are out there that we can use, right? And I know you also work with rural populations in Florida. Have you found one or the others to be the most successful or a combination of the ones to be most successful in your work? And then how did you measure success? Like, what does success look like? Because, you know, and speaking to Tiffany and David, maybe success with Tiffany could have been like, we pivoted during COVID. That in itself is successful. And David could have been like, we worked with the community. So even though we had great outcomes, the community engagement was also a part of our success. So can you lend a voice to, you know, what you found to be most successful and how success has been measured for you in the work that you're doing?
Yeah, thank you. So I've run large trials where we have 30 different clinics participating. So I just did one in an urban area and we're rolling out one in a rural area now. So the clinics get to choose some of the elements. So we planned in, you know, here's what they could choose to change. But what's the most successful, I think, is really when the community gets involved, like others have mentioned. We've done provider trainings and we had to pivot as well to go on to Zoom. We were going to go in their clinics, you know, and then COVID happened and nobody wants anywhere near, you know, nobody wants to see you. So we said, okay, like, that's fine. We can still talk to you. So we did that online and we did focus group. Actually, we did role playing with providers, which I wasn't actually planning to talk about that, but I realized now that was one of the most interesting things to see because we did it on Zoom, we brought providers from different clinics together. And so they got to say, you know, I've dealt with this difficult situation by doing this, and I've dealt with this by doing this, in addition to what we were doing. So it was wonderful to see them all kind of think they left saying, you know, this was really applicable to what I could do. And I can see that others struggle here as well. And so it was great to be able to say, oh, great, I'm leaving with a tool that can help me. And so that, I think, was one thing that was really successful. And I don't want to endorse that in particular because you're asking me what's the best. And I don't want to say like that was the best. That was just a great experience for us. We measured it in a lot of different ways. We did surveys and asked the providers before and after for, you know, how they're recommending, what are their thoughts on HPV vaccine. We did monthly surveys with them where we asked them, you know, did you see this patient? And then if you did you recommend the vaccine? And then did you use a strategy we suggested? So we were able to see, are people actually using it? And then we actually audio recorded them with patients. So we could see what were they doing. They told us what they were doing. What were they actually doing when we saw them? So it was really great to see. And then we did vaccinations, right? So we had a whole bunch of different levels where we can say, okay, even if and one of the great parts is even if your vaccination rate doesn't change, like how far did you get, right?
Yeah.
What was successful? And then you can use that next to tweak it in your area.
Yeah, I think you bring up a good point because we always think that vaccinations is the end outcome, and it is. but there are other things that are incrementally as important to moving towards obviously that. And by changing the needle, pushing providers closer to, or health systems closer to, and giving them the resources, we're still making advancement towards improving those vaccination rates overall, or even, like you said, moving from one dose to completion of the series. And so great, thank you for sharing that. So I'll pivot. We're running a little bit low on time, but I'll pivot to one last question. Resources and tools that you've seen has been really influential, or you've used a whole lot. And it may be a part two to the first question, but resources and tools that you find great value in some of your EBI work relevant to HPV vaccination. So I'll start with David, and then Tiffany, and then Stephanie.
Great. Yeah. So, instead of just giving you a list of all the tools, I would say things like this training are really important. So to build off of what we'd all been talking about, going into the communities and let them drive a lot of these interventions and adapt them is so valuable. At the same time, often the clinics or communities, they have very little experience with things like quality improvement. How do you measure things? How do you do quality improvement in still a robust way and maintain fidelity of the intervention that you're giving while allowing for that, community or clinic engaged adaptation? And as a result, I think what we do offer, and by we, I mean anybody that's kind of leading this, right? It doesn't have to be a researcher or implementation scientist or anything. It can just be somebody that says, hey, I'm going to be the vaccine champion in my health system. And, but what I think that you do bring is you can bring a set of skills and how to do this well. So this training is awesome, right? Everything that Dr. Stars just went through in how to properly, in a robust way, how to select and adapt and measure evidence-based interventions is really important. Some other things I've used and have told people about is the Institute for Healthcare Improvement, IHI Open School. They have some great just kind of trainings on quality improvement stuff. If you're like, well, this is a lot of information. I just need more kind of about quality improvement in general. How do I do quality improvement work? The CDC has some great immunization and education resources as well. In addition to things like IQIP, I've had some vaccine champions and clinics and organizations like those types of trainings just to learn a little bit more specifically about doing quality improvement work around vaccines specifically. Those aren't, most of those aren't specific to the HPV vaccine, but they do translate really well into this work. And so I would encourage people to check out all of those types of resources, because you can come in, you're not the expert at their clinic or their community, that's their job, but you can come in as the expert in how to do quality improvement really well. And I think that's important.
Yeah, so I think you provided a lot of great general resources, right? And that can be tailored down. And I like what you said, like, no one expects you to be the expert, but we have some really cool resources out there. Bring them as examples and work with the community to build what they need for them. And I think that gives them and gives you kind of like a jump start, right? To get the work moving. Thank you for that. Tiffany?
Yeah, so very similar to what was just shared is my biggest, everything that has been shared, Dr. Higgins, Dr. Saris, been phenomenal. But ACS, I have to give a shout out, obviously. If you have an ACS partner or representative in your area, we have a wealth of resources that we can help you with. If you're even trying to get started on a project and you're just uncertain as to where to start. Quality improvement training. We know we come along beside you, and there's no need for you to reinvent the wheel, right? Resources, education materials. Like I was mentioning earlier, those client reminder cards that my system sent out. We have those. A lot of those Spanish materials we were talking about. Provider education. We have templates that are created already that are fantastic. So I would highly recommend you connect with your ACS staff partner. And if you don't have an ACS staff partner in your area, don't let that stop you. The HPV Roundtable, obviously, have to give a shout out to them. They are a wealth of support, have a fantastic resource center. The community guide that was mentioned earlier. I mean, once again, I could sit here and list off all the things, but then just as has been mentioned time and time again, those champions in the community, as was said, they don't have to be experts, but they know their community. And that is one of the most impactful things that I feel like you can have, is because you have to know who you're trying to educate, who's out there. I mean, if I had not partnered with my system, knowing that, they had a large Hispanic population and I had gone out there and just tried to disseminate, English materials, I probably would not have had as a successful experience as we did with this project. So yeah, I mean, just any and everything, and there's not going to be one size fits all, right? It's not. You're probably going to have to test some things, go through a process, see that may not be hitting the mark, may not be creating what you want. Then just go back to the beginning. Don't look at it as a failure. It's not. It's a step to success. And you may say, okay, that didn't work. What can we do now? Let's reach back out to this person and use that circle of influence I mentioned earlier, those networks, those connections, because they can have such a ripple effect on everything that you do. So you never know that phone a friend who they may have a digital billboard somewhere that you need to expand your project. So
yeah, and now we know that you are connected to the billboards and David is connected to
exactly.
radio. I thought radio was dead, but apparently it's not.
It is not. It is not.
Now we know that if you ever are interested in using that as part of your intervention, these are two networks and connectors that can help you get that done. So yeah, I do think that using your ACS representative in your area is a great thing. I know from the roundtable's perspective, sometimes when we create new resources, it's because people are asking and they say, hey, we really need this, or we're seeing a gap in this. And I know that the ACS staff also does that and tries to liaison. So yes, ACS field staff and the networks around you to help catalyze the work. Dr. Stars, we're going to round up with you. Any last resources or tools outside of the ones that you've highlighted today that you think is of great value or consideration?
Yeah, thank you. So the only two that I would add that people haven't said, one, we mentioned it, but your Department of Health or whoever runs your state immunization registry, they have amazing resources on how to get those vaccination rates. Most clinics don't know how to do, and it's just a couple simple clicks. So you can learn that and then teach others how to do it. Or they're actually willing to meet with the clinics, go through, clean up their rates, like all of that. So the Department of Health and your immunization registry, we haven't talked about much. And other colleagues working in this space, I've found everyone to be amazingly helpful and willing to share their strength, what worked for them, what didn't, what kind of resources do they have. So feel free to reach out to people. I think everyone's, wanting to move the needle on HPV vaccination and happy to help others.
Awesome. And I will do a plug shamelessly for our organizers for this event, Ashley Lack and Christina Turpin for the Roundtable. They are the brainchild behind all of this. So if you ever have a follow-up question for our panelists, or if you just want to learn more, they are also your extended network to learn more about how to implement EBIs. And so I want to go ahead and thank our wonderful panel. It has been such a great, amazing conversation with you. And I will turn it back over to Tina. Or Ashley? Tina, let's go ahead and turn over to Tina.
Yeah, thanks, Gabby. And I will echo Gabby in thanking our amazing panelists today for discussing the challenges around selecting and choosing evidence-based interventions. I'm going to go over some wrap-up steps and give some action items for you today. Get to the next slide. So we have shared this during our monthly calls, but I want to revisit our external facing website that's been built out for all of you to access during this 10-month journey together. And I wanted to call your attention to the top of the page under important links. This includes recordings, slide decks of our monthly sessions, and resource roundup. I know some of you in chat were asking about some of those, and you can find them all here on this website. And under monthly recordings, you'll find all the past sessions if you've missed any as well. And now we're going to have a link in there as well if you need the link to this website. And then also we've put together a resource roundup from each session, and you'll see continuing education opportunities, HPV vaccination data resources, QI documents, materials around HPV vaccination at age 9, and robust resources around quality improvement from the June and July resources on this as well. And we're regular updating this. So if you think, oh, I've already seen this, maybe take another look. We are constantly adding things. And if you have something that you believe is missing, please send it to myself or Ashley, and we'll make sure to add it to the resource page. All right. And this has been mentioned and talked about throughout, but we are also have this great guide to help you explore the EBIs that were discussed today. And you can dive in a little deeper with this guide as well. And it should be linked on the page as well as in the chat currently. And then now we should launch our last poll here as a great kind of call to action to you guys. So in the next 6 months, do you plan to use the knowledge gained today to implement EBIs to increase HPV vaccination? Which EBIs do you plan to implement in the next 6 to 12 months? And what tools and resources do you need assistance with to successfully implement these EBIs? So I'll give you guys just a couple minutes to do that. All right, coming in now. I know it's hard to think about life in the next 6 months, but we're hoping that today's sessions will help you guys. A lot of people are loving patient education. To see provider staff training. We have some great resources around that. So definitely here to help for that. I'm loving seeing there's a lot of the provider staff training alongside patient education, it looks like. So I feel like those two, as we heard through the presentations, you know, EBIs together do great things. I'll give it one more minute. We're almost past 50%. Leave that up another minute while I go to the next slide for you guys. So here is kind of where you've been, as well as today's session. And then you can see September, October, November, and December here. And we'll be back with you guys on September 18th for the PDSA cycle. So we're really excited for that. And we can go ahead and close that poll now. So for our call to action today, check out the website and look at the resource roundup that we've talked about. And make sure to bookmark that. So when you need it, when you need the resources, it's there. It may not be today, it may not be next month, but you want to be able to have that to pull up as you go through. And then as we prepare for our September session, we ask you finalize your future state process map, finalize evidence-based interventions to make changes, improvement, and begin implementing interventions and start testing their success via PDSA cycle. So we're going to go through that a lot in the September session. So if you do this homework, it'll make the September session really hit for you guys. Thank you so much for being here. I hope you had some amazing takeaways from the presentation and from the panel, and we will see you guys next month.